Everyone take their seats, please. Get started on time. Welcome to the Heritage Room. I'm glad you all found it. I don't think we left anybody downstairs. So, in case you hadn't realized, the control of the rooms downstairs is now with the library rather than the Marquette Arts and Council, down to the old chamber building. So, it's a new scheduling for rooms. The downstairs room was not available for our meeting, so at least this meeting and the next two will be either here or across the hall in Tariffs. So it shouldn't be hard to find even if you don't know which room. And from there, we'll take it from there. We'll work on scheduling. We don't have a microphone in here. Are you hearing in the back okay? It's got better acoustics than downstairs, so. But, wave at us if you can't hear us, okay? So, the meeting's open and welcome. Come on in. I want to especially welcome the new members that I believe have come in with us since our last meeting, which was actually September 10th. Claire Toohey. Hi, Claire. Thank you for joining. And then our two interns are now members as well. That's Iris Bailey, who just came in. And is Christina here? Didn't see her. So Christina Caraco is also our intern and now a member as well. Berkeley Thompson joined us last meeting. Some of you may have met her. I don't see her here tonight, but she's another new member. So our member numbers are holding close to 130, I think. If someone has a more specific number than that, I think close to 130. Okay, so we're going to start off with our land acknowledgement this evening. Sandy?
Do it from here if that's okay. I would just like to acknowledge that Peter White Library and the city of Marquette occupies ancestral and contemporary lands of the Anishinaabe, Three Fires Confederacy, the Odawa, the Ojibwe, and the Potawatomi. And we give our respect for that. And it's also, Monday was Indigenous Peoples Day, and I was doing some reading prior to coming to the meeting, and there were a lot of celebrations around the state, which was nice to see, including at NMU. So the culture is definitely alive and hopefully doing well. Thank you.
Thanks, Sandy. Come on in. We're just starting. There's seats up front. Of course.
Just like church.
For those of you who are newer, we do the land acknowledgement each meeting, but it isn't necessarily Sandy's job. Anybody who's interested can do it. We have things written out. You don't have to memorize it. So if you're interested, please see Sandy or Lynette, right, with the EIA. So talk with them if you are interested. We usually have the acknowledgement and then a little bit of information. So feel free to sign it. So our first piece of business is to approve the agenda, which you all should have gotten in an email. Do I have a motion to approve? Johanna? And second? Meredith? Get that okay? Okay. Lynette, bless her heart, Lynette is our secretary pro tem tonight. So if you have, anyone who has a report, if you have anything written, you might want to give it to her later. Okay, so any questions or concerns about the agenda? All in favor of approving the agenda, say aye.
Aye.
All opposed, no. Okay, we have the agenda. Then we need to have a motion to approve the minutes of our meeting on September 10th, way back then. Agree? Thank you. You have a second?
Support.
Jake. Okay. I'm bad. I can't read it. Any questions, comments about the minutes from the last meeting? Okay. All in favor of approving the minutes, say aye.
Aye.
All opposed, no. Okay, we've approved the minutes. We're going to have a few reports, and I'm going to start with the nominating committee. Sandy? Sandy? No, oh, I'm sorry, wrong person. I know. I asked her. Take it over, ma'am.
Good evening, I'm not Sandy.
I know, she's doing a different one.
And I am the chair of the nominating committee, and we wanted to bring a quick message to everyone that we do have several openings on the board for next year. So, if you are interested, please get in touch. If you can think of someone who might be interested, we won't tell them that you nominated. We will get in touch with them and find out if they're interested, so you don't even have to do that. If there's someone you think is deserving. We have leadership roles that are going to be open, and we have director roles. Those are a little different. We will be meeting with current board members, leadership members, to get a little bit of an overview of what they like about their position, what is difficult about their position, so that when we do talk to people who might be interested in taking a role in next year's board, we can give them a better idea of what they're taking on. Please, this is important. We want to make sure we have really good people. I know it's hard to think that we'll ever find anyone as good as the ones we have, but honestly, they're out there, and we want you to consider becoming a part of the leadership of our chapter. So thank you so much. You can email me, or Barb O, or Pre, and just say, you know, I'm kind of interested, or anonymously, I think so-and-so would be great, and then we'll, thank you.
And if you're thinking about it, but you don't want to take that step, but you'd like to talk to one of a board member or someone who has a leadership role, please do. You know, it's not a commitment. Approaching us doesn't mean you're taking the job, but we'll be happy to talk it over. Even do like a shadowing thing, an observing thing, if that's something you'd like. Thank you, thank you, Madeline. Sorry, Sandy had a report about something, didn't you?
Voter services.
Voter services, yes. Okay.
Do you want me to do
Why
that?
not?
Okay. Let's have a couple of quick things. So we had one high school visit, that was Marquette Alternative High School. Went very well, 21 students. We had them all look up and see if they were already registered. Many of them were. And then we showed them how they could register just right online. Plus we had other voting information. They're always a great group to visit. We will be, I just learned, visiting Munising. At the end of October, so more on that later. We also had a Hooked on Voting activity for the younger kids, and that was at Peter Waite Library. 96 participants and 50 bookmarks and good information were passed to the parents, so that's always a fun activity for the kids. Just a couple statistics I wanted to show off, because we should be proud of this. So in the range of 18 to 29-year-olds in the last election, 58% voted in Michigan, and that is the highest in the nation. So we had the highest, that's the highest increase in the nation. We had the highest turnout for the 18 to 19-year-olds. And that is probably due to the pre-registration that they do now when they apply for a driver's license, or that they can just go online and pre-register. So that is really cool. Couple things, November election's coming up, it's real small. There's a mini guide out. If you're in the city of Marquette, there's an election. There's a couple of proposals in the townships, but not many. So it's going to be a real low-key year. And of course, you can go to vote411.org. And if you're in an area outside, or just even Marquette area, look at the voting guide and look and see if there's anything else in your area. And that's all I have. Was that?
The guide online?
The guide is, yeah, the voting guide is on. Oh, and I believe the voting guide is, the print voting guide is on our website now?
Yes.
Okay, yeah. So there's a lot of places to get it, and I have 2 copies here.
Thank you, Sandy. A lot of good activities. Sue, since you're standing already, would you like to give your report?
Oh, and Dr. Highway?
Yes, please.
So, You know, the league takes part in Adopt a Highway, which entitles us to a sign. And last year, our sign got moved to 41. So we have 2 signs, one coming and going on 41 by Castle's Corner and Green Garden Hill. So we had 11 volunteers that came out for Adopt a Highway. We picked up 22 bags of trash on the 4th of October. We lost a member. We lost a car full of wild, but all's well that ended well. And it got pretty hot, but hooray that the universe has always smiled on me because I've never had to cancel an Adopt a Highway for inclement weather. So we do 2 out of 3 pickups every year. Keep in mind that people only walk a mile, and we have a 2-mile stretch of highway, so it's kind of fun. And then we all went to this, well, about 6 of us went to the smokehouse barbecue and had lunch and chatted about the funny things that we picked up on the highway. So come join us, it's fun.
Thanks a lot. And the highway's a lot cleaner, so that's good.
Yes.
And you didn't leave the car or the member in the ditch, right?
And the member was rescued, the car was found.
That's cool. Okay, we did that one. So I'm going to report on a couple things. You know, it's been, what, 6 weeks since the last meeting, roughly. So a lot of things have happened. You've heard about the National Voter Registration Day activities that actually take place through a whole month. We had that meeting. We have had a strategic planning meeting. We've mentioned this, but we did have our whole day-long retreat for strategic planning. And there were about 19 of us, board members, non-board members, previous board members, new, old members were there. And Pam Christensen was our facilitator. And it was out at Sandy Breitenbeck's family's camp, which is right on the Laughing Fish River. It was lovely. We fed ourselves. It was great, but we got a lot of good work done. And strategic planning is something you do infrequently, and you're looking ahead 3 to 5 years. Kind of when we started this league, that was kind of like strategic planning, because we were looking ahead to put it together. Now is the time we've decided we want to look ahead in an organized way, and that's what this kind of planning does. We will be meeting, the whole group that worked on the strategic planning and those that have been invited are going to be gathering again on the 22nd to receive the report that Pam's putting together about that day. And then we're going to rotate the process another step, looking at goals and objectives. So the leadership obviously is involved, the board's involved, committee level people are involved. We're going to be sending these things to the committees to turn over and think about their ideas, and then we're going to be coming back together. The whole membership will hear our completed draft report in January. But you'll be getting some information to be thinking about, and we want input. So just be looking for that. And then the other big thing we did was we did a candidate forum. In fact, we did 2 plus a presentation. We did 1 candidate forum for the Marquette Board of Light and Power. I did a little presentation on all the petitions that are circulating this year to hopefully become proposals next year in the election. And then we had a forum for the Marquette City Commission. We had good attendance, we had lots of volunteers, we had citizens there, all but one of the candidates were there, which was very nice. And we've had, Laura, about 130 some views? Yeah. 152 views, both live stream and the recording is out there on our YouTube channel. So certainly if you're a voter in the city of Marquette or in the Board of Light and Power area, you might, and you weren't able to come, you might want to take a look and see what those candidates had to say. And we're already starting to think about what forums we want to do next year. We had good volunteers, we had people learning new jobs, but there's always room for more, and we want to let everyone participate who cares to. Okay, the last announcement or report is from David Allen.
I just joined the Marquette, City of Marquette Board of Elections, and there's going to be either 1 or 2 openings. I think there's 1 now, and there'll probably be 2 soon. And Kyle Whitney, the clerk, is very interested in getting people to apply from the league because they know how much good work we do. It's fairly easy work. There's about 3 meetings per election. One to look at all of the candidates who have applied to run to make sure that their paperwork is okay. The second meeting to approve all the poll workers and captains. And then a third one to actually make sure the machines are working. So it's pretty easy, but it's very important because if something goes wrong and the world descends upon us, we need people who know what they're doing to stand up for how our elections are prepared. And so I encourage anybody who wants to apply, you just go to the city website. It's the normal application screen, the boards, and put your name in. So, thank you.
Dave,
Yeah.
if you work in an election as a poll worker, are you eligible, or does that disqualify?
I don't know the answer to that. Okay.
Because they asked.
Okay.
You can't.
Okay. All right. So if you already are a poll worker and want to continue, you can't do this as well. Yes.
And one of the qualifying requirements is that you be a resident of the city.
Resident of the city.
You can't
Correct.
be in the township.
That's right. So if you don't want to be a poll worker and you live in the city and you want to do this, please apply.
I just wonder if, and we have, this isn't.
Oh, sorry.
At the environmental committee report, I don't know if you want to report on Jim Hill, we had or I can, it doesn't matter. We have time. We have an upcoming event.
Oh, then please announce it. And
October
give whatever
14th.
report you want. Donna, stand up, please.
What's the date? That's today. Yesterday. Never mind.
Never mind, nothing to report, we're good.
2 days.
We had a wonderful tour of the water treatment plant.
We had a wonderful presentation from
And a
Dept.
great presentation from Jen Hill, that's right. On, that's the problem when it's more than a month, right? Lots of things happen. But that's why we don't have too many announcements about upcoming things. I do want to mention this Saturday, excuse me, is the No Kings Rally, which the league is a partner in. So we encourage you to participate. You can wear your league shirts if you want. You don't have to, but participate if you like. We recommend if you identify as a league member that your sign is nonpartisan, please. Sorry. And there was one more. No, maybe that was it. Okay. So I'd like to take a few minutes before we do our program to make sure we have time for member comments. If there's anything that any member needs to tell us or wants to mention, just stand up and tell us.
Okay.
Yes.
Hello, I'm Leslie Addison, and one of my good friends has recently appointed me a microcirculator for these petitions. There are 3 that I have with me, and I think probably Joe is much better versed at what they are than I am, but I have the Invest in Michigan Kids, the Make Michigan Vote Count, which is the ranked voting petition, and then I also have the one that is for getting corporate money out of our elections and out of politics. So I will be out in the hallway with my black pen afterwards if anyone would like to sign one of them.
Thank you. Anything? Yes, please.
I have a question here. What's the rally? Where is the meeting point?
It's at Wilson and 41, which
By Wendy's.
or by Wendy's, right?
Okay.
And you can park back in that area, basically, right?
Yeah, so, sorry, I'm Judy Kitchen, and I'm one of the co-leaders for Let's Carry Region Invisible, and we and Ubers Unite are organizing the No Kings demonstration. We're trying to use the word demonstration And so we all pause before we say protest, demonstration. So we're asking people to, the one and only parking lot that we have permission to use is the space that's behind Wendy's. Not directly, not Wendy's parking lot, but behind. And other folks had parked, we've done several of these events now, in the lot that had been, the lot that's there, where former Dollar Tree and Pizza Hut, we explicitly do not have permission to park there. But people do. So we're letting folks know, park at your own risk. The owners of that lot are in Wisconsin. But park at your own
Find
risk.
legal parking
And
if you
so
can.
find legal parking, and we're asking folks to move on up west as far as you can. So the park behind Wendy's, and there will be a team of people there parked in park cars and give directions. So moving on up the narrow pathway that we call the sidewalk, right of way, and we made room for about 2, maybe 3 people deep. So you keep moving on as far as you can go west. And if you would like, you can also, of course, be on the north side.
Pick on the bypass.
Okay, that was my question. You can be on the other side of the street too.
Can be on the other side. And then it's parking again, where you can find a space, as long as you're not in a space that's, of course, marked no parking. Interesting to share that one time we had permission to use the Huntington Bank parking lot, and we no longer have that permission. So I'm thinking the more that we do the deep dive into who owns these lots, we may, and it's understandable that folks have some concerns about.
So Judy, could we sum it up by saying either park in the lot behind Wendy's or don't park in a retail space to be safe?
Yes.
Find legal parking?
Yes, find legal parking. Yeah.
Good, thank you.
Are we to wear yellow? I saw some
You can.
message of that. If possible, wear yellow.
Yeah. You might need your yellow rain slippers. Or not, depends on what day you're looking at the website.
And it starts at 10:30, right? 10:30 a.m.?
10:30 till noon.
Okay,
Thank you.
any other member comments before we start our program? Oh, okay, Carla, would you introduce our speaker, please?
Let me know if you can't hear me. It is an honor to introduce Dr. Robert Van Howe. Dr. Van Howe is a board-certified pediatrician. He practiced general pediatrics for over 30 years. He was a founding professor and chief of pediatrics at Central Michigan University College of Medicine. Dr. Van Howe is a graduate of Michigan State School of Public Health. He has been the medical director of the Western UP Health Department and Dickinson Iron District Health Department for 6 years. And last year, he became, fortunately for us, the medical director of our Marquette County Health Department. And this spring, he was appointed the medical director for public health for Delta and Menominee County. Dr. Van Howe is a member of our League of Women Voters of Marquette County. And the topic of his presentation this evening is how federal health care funding and policies have affected health care in Marquette County. I can't imagine anybody more qualified to give his views on this important issue. There will be an opportunity for questions and answers at the end of Dr. Van Howe's presentation. So Bob, take it away.
I gotta get my computer working here. That's always fun. Good turnout, guys. I appreciate this. I know you came for the rest of the meeting and then you're stuck listening to me, so. Take it from there. Yeah, we'll show me hooked up on this before. What happens is that I was asked about a month ago to talk on how federal health care funding and how recent changes during the administration are impacting Marquette County. And nothing's happened since then. There are 6 health districts in the Upper Peninsula, in the 15 counties. Only Marquette County and Chippewa County have their own health departments. The rest of them are districts that have between 2 and 5 health departments. The areas that I'm in, the medical director covers 10 of the counties and 4 of the health departments. The health departments act independently. They have their own budgets, they have their own boards. They are not part of the state Department of Health and Human Services, but we work closely with them. Okay. The mission of the health departments is enriching lives in our community by preventing disease, promoting healthy lifestyles, and protecting the environment, while the vision is to have a community where people achieve the highest quality of life through healthy living by caring for themselves, one another, and the environment. So in 1978, they had the Public Health Code was put out. It has a number of essential health services that we have to provide by law. It's been amended. A few things have been added over time. The essential health services are like food safety, restaurant inspections, food trucks, things like that. We also protect our water by looking at private wells to make sure they work properly. We test the surface water as well as swimming pools. We also look at wastewater, so septic systems are inspected by us. We provide vaccinations for children and adults. We do infectious disease control. So there are a number of reportable illnesses that we follow up on. We try to find out who you've been in contact and how we can protect other people from doing that. That went into overdrive during COVID-19, and we're geared up in case when we have, not if, but when we have our measles outbreak. We also treat sexually transmitted infections. We do hearing and vision screening services at the schools, and we also are doing oral health screening in young children as well. I have a list, there's a long list, a very long list of the other services that the health department provides that are not among the essential services. What basically we provide services that are valued by the community that the private sector cannot or will not provide. Either it's too costly or they lack the infrastructure, but people still feel that they're important. So funding for local public health is a mess. We have 70 to 90 different funding sources in each of my 4 health departments. Each program addresses specific issues. Each program has different time horizons. Each program has specific onerous documentations, regulation requirements, and paperwork that you have to fill out. And all of them have specific strings attached to them. In the smaller health departments like the ones I'm involved with, the employees oftentimes wear several hats. So they'll be involved in between 2 and who knows how many programs. So they have to keep track of how much time they spend on each program in 5-minute increments and hand those in. So it is an accounting nightmare. And for those, we have a couple people on the health board here, they know how Bill Mattson does a great job, and if he ever retires, we're in trouble. We do bring in money, okay? Some of it is through licensing fees, like when you're well and septic permits and the restaurant inspections, that's only 5% of our income. We get about 15% of our revenue from billing insurance for health services provided. We get some allocation from the county governments, it's about 8.5%. 63% of our money comes from government funds. Most of that comes from the federal government. The federal government sends the money to the state takes their cut. Don't get me started on that. And then it's given to the local health departments where the work is actually done. We also get direct grants from the federal government, and we get direct grants from the state government. About 6% of our money comes from grants that are from other organizations, such as Superior Health Foundation or the Michigan Health Endowment or Fund, and other private organizations that want to get involved in public health. It would be much easier if they just gave us the money and said, do your job. Because one of the things that happens with these funds is they can be sent to us and then we don't need them. This happened during COVID. There were hundreds of thousands of dollars in each of the health departments that they sent us to do COVID, kind of as COVID was winding down. And so we had to send all that money back. There are unfunded mandates, that's just the way government works. There's also time restrictions. So the funding has to be used before the funding timeline runs out. And if you don't use the money, you lose the money. You can also spend months applying for a grant and then not get it. So you wasted several months and then you didn't get the money. Money allocated to Michigan by the federal government during COVID was left in limbo at the state legislature. They didn't want to allocate it because it would make the other party look good. With these variables impacting 70 or more funding sources, the operating budget requires frequent adjustments, as the people on our board are well aware of. I think it changes on a weekly basis, but I'm not sure. So what is our current state of affairs? Chaos. Okay. Federal funding for local health departments is in a state of uncertainty. We don't know from day to day whether programs are going to be funded or not. There have been executive orders contradicting the acts of Congress that are currently in the courts, and most of them have been overturned, but then they're on appeal, and we don't know how long the appeal process will take. So the advice that's been given to local health departments and to state health departments is just sit tight. We don't know what's going to happen. There's no reason to act because it could change tomorrow. So some of the areas that have been impacted, reproductive health. So shortly after this administration got in place, the CDC guidelines on contraceptive and STI treatment disappeared. They weren't on the net anymore. And those who practice medicine, we use those on a fairly regular basis because you can't commit all that to memory. So you have a special situation, you could look it up on the CDC's website and they would give guidance in one of our, you did obstetrics gynecology, right? You know exactly what I'm talking about. So all of a sudden you're going, okay, I didn't memorize that, where am I going to find it? There's also limited vouchers for gonorrhea and chlamydia testing. I think one of my departments got like 600 for the year. That'll last about 3 months because we test all women for those illnesses when they come in for their visits because it's part of standard of care. Planned Parenthood has been targeted, so it's hit or miss on what's going to happen there. There's been talk of putting Title X services on the chopping block, and that's reproductive health services for people with limited resources. One of my favorites is at the Pregnancy Risk Assessment Monitoring System. They took the information off the internet, the web. They had to get a court order to put it back on that information, back on the web. What this does is they do the surveys of people during their pregnancies to find out what outcomes they have. So basically it measures maternal mortality and infant mortality and a bunch of other things. The program for monitoring that has been discontinued. So basically, we have in the United States not a very good maternal mortality rate. So the best way to make that problem go away is stop collecting the numbers. We did have a little scare for our school-based services. That was more at the state level. I don't know if you people were aware of that. We have a couple of school-based clinics in Marquette County at several of the schools. They wanted to change it from categorical spending into just a general per pupil amount. And that would have probably wiped out all of our school clinics. But they didn't do that at the last minute. And that happened in the time from when I was supposed to give the talk. They scheduled me for October 1st and now, so that's already changed and gone away. So I'll give you an example of how things can be pretty fluid. The one that scares me is how responsive the federal government has been to outbreaks. You may have heard it was in the newspapers, there was an outbreak of measles in Texas, okay? When the outbreak started in Texas, the local health department tried to contact the CDC. They didn't call back, and they didn't call back, and they didn't call back. It took a number of weeks, and it was only after the first patient died from measles that the CDC responded. So what happened is a number of the CDC staff the ones who weren't fired by DOJ, were assigned to scrubbing their websites of gender identity language. Good use of their time. And other CDC staff feared that they would be retaliated against if they assisted in the Texas outbreak. And then on top of that, we had misinformation spread by the Health and Human Services Secretary. That didn't help either. We're in a situation here in the Upper Peninsula. We have one county in particular where if we have a measles outbreak there, it'll make the one in Texas look small. And so we don't know if the CDC has our back or not. Another one that was the Youth Risk Behavior Surveillance System. And that's another, they do surveys of kids in high school and in junior high. And they do it every year, and they use that to get an idea of what type of behaviors are going on in the area. And we could use that numbers to see if our interventions are making a difference or not. So very helpful, useful data. That data got taken down. And it took a court order to have them put that data back up online. And when they did put it back on, they had a number of disclaimers about their data on gender identity. All right, emergency preparedness. Believe it or not, a lot of people don't realize this. The health department has an active participation in emergency preparedness, and that's pretty much came to being after the anthrax scares after 9/11. We're part of a multimodal response. We make sure that there's safe emergency housing, clean water for the people that are housed there, safe food and wastewater systems. And over the last couple of months, whether there's funding or not has been driven by rumors, and some days it's on, some days it's off. And I guess it's back on again, but then again tomorrow that could all change. The problem is it's very hard to hire people or keep them employed if you don't know what's going to happen. And in some of our programs, we have had to lay people off just because the funding's uncertain, because we really don't know what's going to happen. Vaccines are in flux right now. The Advisory Committee on Immunization Practices, ACIP, the membership was completely kicked out and replaced. The analogy I like to use is what would happen if the Tigers fired all their players and replaced them with highly opinionated fans who've never played the game. I think it works, okay. Right now, medical professionals are looking at medical specialty organizations and other authorities for guidance. And I have to give Dr. Bagdasarian, who's the medical director for the Michigan Department of Health and Human Services, she went on her own and said, these are our recommendations for the COVID vaccine, and we're just going to stick by them because the science hasn't changed. And there's a consortium of, I think it's Washington, Oregon, and California have decided to do that as well. Michigan has its own vaccine advisory committee. I think they're going to start going along with them because they're going to follow the science. The problem is that this basically puts some uncertainty on which vaccines are going to be available and who's going to pay for them, whether there's going to be reimbursement for them. A couple other things have happened recently in the news. You may have heard about them. There's been the government shutdown. Okay. Who knows what's going to happen? One of the things that's happening during the government shutdown is that the Substance Abuse and Mental Health Services Administration, that's part of the CDC, a lot of those people have been fired during the government shutdown. It's not, they must think that substance abuse and mental health are not important issues. I can tell you that I completed the Upper Peninsula Community Health Needs Assessment. We did a survey, and two of the biggest issues that people in the UP see as an issue are substance abuse and mental health. And the other one is a shortage of dentists. What does the future look like? Well, the local health departments are going to continue to do their work. Even though we don't have funding right now, we're working on our reserves. So we have, a month or two of reserve, cash reserve, so we can keep providing services because we feel that they're important. It's going to be like COVID-19 all over again, where we're isolated. We're on our own. We can't depend on the state. We can't depend on the federal government. We have to use our own resources to deliver our services, which is a good thing because we have good people. We have excellent people that are dedicated and really, really involved in this. And so, I'm surprised that we didn't have more people burn out during COVID. We had some, but boy, the core people, they can do the job, they can get it done. We may have to look for alternative funding. It may involve increased government support at the county level. The other part that is uncertain is with the number of people who are going to lose their health insurance and their Medicaid insurance. We're going to have, they may force the local health departments to provide healthcare services now provided by hospitals and clinics. In my four districts, we're not set up to do that. In other health departments, the larger health departments downstate, they're big enough, they have clinics and whatnot, but they could be easily overwhelmed. So we have a lot of people who won't have access to healthcare, and it's not going to make them healthier. I mean, there has been some estimates that with the cuts in Medicaid, we probably see 50,000 additional deaths, early deaths, across the United States. So it's not an insignificant number. I kept this short because I figured that questions would be much more interested in my talk. So if there's any questions, we'll see if we can field them. Yeah.
Is there a new vaccine or booster for the fall for COVID?
Yeah, there is one.
And do we have it here?
We have it here, yeah. I'm glad you didn't ask me that question a couple of weeks ago because it was uncertain. Yeah. Yes?
So does this isolationist, chaotic shutdown resemble anything in the past that we've had to deal with? And can we take that historical perspective and put it to work before the event? Do you know what I'm saying?
Mm-hmm.
Like, or can we mobilize neighborhood watches to kind of help people out through this? Because what happens best is peer-to-peer, person-to-person, helping each other out.
Yeah, I wasn't around for the last shutdown, but I can say that the concept that all politics is local kind of applies here. And we're going to have to, we may not be able to rely on our state and federal partners like we have in the past. So we're going to have to, take care of our own. It wouldn't surprise me. Yeah, I don't have a good answer for you. I'm sorry. That's the best I got. Yeah, go ahead.
So with the Medicaid and Affordable Care Act cuts, from your perspective, are there any particular hospitals or services that are most at risk of being closed in our area?
Well, we've seen a number of obstetrical practices in hospitals shut down. And I see them as the canary in the coal mine because they're the most fragile, the most, they're the most vulnerable. I think it's hard to say. Different, some of it's driven by finances, some of it's driven by demand. So it's hard to say. I think, right now we don't spend enough money on primary care. And so we've had a problem with that. Going back to my health needs assessment, we have a lot more people on insurance now, but we haven't seen any improvement in the percentage of people who see their doctor every year or have a person that they identify as their, personal provider. So, yeah, it's hard to say. Wow, way in the back.
Do you see any role for community volunteers as the financing shrinks?
Yeah, I think that would be a great thing to develop. One of the things that we have been working on is to use community health workers. And one of the things about community health workers is that that's been something that's been used in third world countries. And now we're using them here in the United States, and I don't know what that says about us. But yeah, I think, yeah, there's a lot to be done, a lot of footwork that can be done by volunteers. One of the things that I discovered, I was doing the community health improvement plan in the western 5 counties, is that there was a lot of transportation issues, transportation to care. And one of the difficulties that they have is having volunteer drivers because they have to have insurance and all this other stuff, and there's so many barriers to it that it got in the way. The other thing I found out from the health systems is that the number of volunteers that they're seeing disappeared during COVID. One of the things is that the volunteers that they had were aging out, and the other thing is people, I mean, we have a rash of individualism. We have an individualism epidemic of sorts, and so people aren't willing to volunteer. But I think, yeah, that volunteerism would be a great way to address this. Yes?
Do you know what, when I went to the family walk-in clinic of Superior Health, that on the wall, they had a list of, do I need to see the doctor?
Mm-hmm.
Can I wait on this? And the learning ability about, do I need antibiotics? Or, you know, it's too bad there couldn't be a mass mailing of that kind of information to the people, because it would help in the areas like the overcrowdedness that happens in the emergency room, because there's a lot of people who run to the emergency room when they don't need emergency care.
Well, I think some people have used the community health worker model as a first contact for that. I haven't seen that done here, but they've done it in other countries. So, yeah, education is difficult because when you tell someone something, they don't remember it the next time they need it. So it's just like me trying to get on the it worked earlier, honest, it did. We have witnesses. But when it comes to the next time to getting it to work, you know, people forget things or they just don't work. Way in the back.
How's the health department and you as the medical director dealing with the, like, Tylenol causes autism, and you're an expert on circumcision, so now the circumcision causes autism. How's the health department dealing with that?
I think what happens, we've been answering calls one at a time. I've talked to a couple of the obstetrics practices. They had, you know, their ducks in a row and actually didn't get asked that many questions. So I haven't seen many inquiries on that. If you want me to give an hour-long lecture on how autism is associated with circumcision, and it is, I can do that. But I don't think people would want to sit through that. Yeah, education's difficult. It's very difficult. I mean, as a primary care physician, we spend most of our time educating our patients and parents. And so, you know, you don't know how much of it goes in one ear and out the other. And so sometimes providing written information is not what it takes. Sometimes telling something, they don't hear it until they want to hear it. So you run into that barrier as well. So yeah, it's a difficult, I mean, it's not that we don't try. Yeah.
I think you're addressing part of it, that the trust in public health, misinformation, disinformation is coming out. How is the department dealing with this?
We've looked into a couple of different ways of doing that. One is to provide people with educating them about how to identify misinformation and disinformation. That's a big part of it. Most people trust their particular physician or nurse practitioner or PA. They trust what they tell them. Okay, and so they have to develop some trust with them, and that's the most effective way of dealing with misinformation and disinformation. It's not. It's you know, it's been identified as one of the biggest threats to public health. by the World Health Organization. So, you know, what's the old line is that the lie can get halfway around the world before the truth can get its boots on, let alone lace them. So, yeah.
What are the vaccination rates for measles and in general in Marquette County compared to the rest of the UP, the rest of the state, the rest of the country?
I think the Marquette's a little bit better. It's definitely better than some of our counties elsewhere, but yeah, Marquette County does pretty well with the vaccination rates. They still are down a little bit. We saw a big dip during COVID because people weren't able to come in person and get the vaccinations. We're hoping to have a rebound, you know, to make up for it. That didn't happen, and it's continued to decrease since then. Yeah.
I want to get back a little bit to the community health workers,
Mm-hmm.
and transportation came up as something that might fall under that category because they can take people to appointments. But what do you mean by a community health worker?
So what happens is they're actually hired either by hospitals, we have several in our health departments, and they're trained to do things. Some of it's assisting in care, making sure people make it to their appointments. You know, reminding them to get places, and it's some of it's like the stuff that it's kind of hard to describe. A lot of the activities are things that the nurses could do, but you don't need a nursing degree to do, or a social worker could do, but you don't need a social work degree to do. They're kind of there to fill in the gaps. So different programs use them differently. Do you have any in your? No, okay.
Do they go like in homes and maybe
They sometimes do home visits, they sometimes...
there's fall risks
right.
at home, things like that.
We use them in some of our substance use disorder treatment programs. You know, make sure that they're you know, getting their drug testing done and things like that. So it's just a little bit of just making sure these little things get followed through on.
So do you hire these people?
Yes.
And do they have, they must have some kind of orientation or training?
Right, there is training involved.
To somebody's home and assess their...
Right, yeah, they do, there is a training program for them. One of the barriers that we're running into using these people is it's hard to bill for their services. And some of it is grant funded support, but what happens with the grant is that when the grant runs out, the money's gone, and then you have to find a way of providing the service and getting it paid for. Mm-hmm. Go ahead.
Okay, when you said that we may have to rely less on the state, the federal government, and more on our county funding sources, that's a kind of a scary thing to say because sometimes our counties have a hard time fixing the road so we can get from point A to point B. So where is the county going to get, or the city, or the community going to get the money to pick up these additional costs that may come because of what's happening with healthcare delivery under this administration?
I don't have a good answer. No. So, I mean, we saw that during the Reagan era. Reagan cut all the funding at the federal level, and all of a sudden the states who were getting money from the feds all of a sudden had to find a way to pay for stuff. So they had to increase their revenues.
The health department board does communicate a little bit with the county board. We have a liaison that sits on both, and the health department board does, you know, ask the county for money, or they may say, we're struggling, we need this and this for this reason. There is communication there. You know, could it be better? Probably.
Yeah.
You know, but there is a liaison that sits on.
Where does the county get its money?
Well,
Tax.
From
us, yeah.
Taxpayer dollars.
Yeah.
I don't know if people remember, but there was a period of 7 years when we had the Medical Care Access Program. And this was before Obamacare, before the extended Medicare. And that every primary care physician in this county signed up to provide care for people who were without insurance. Often they were their own patients who could not afford their care, and 75% of the specialists volunteered their care. And remember that we hammered together a program that had lab tests, radiology. If somebody needed surgery, then we went to the hospital and bartered at least the Medicaid rate for that procedure, because people without insurance would be charged more than this. But we did this for 7 years until the Affordable Care Act and the extended Medicaid went through, and they were able to provide so many more services than what we could hammer together. We had pharmacy, x-ray, and dental care. We may have, here we are again.
But now we have two
But
flags.
but this county said
Right.
we were going to take care of our own. And there was about 2,000 patients that were
He would never say this, but he was one of the doctors that saw patients in that clinic, and possibly Dr. Storms too. And possibly Dr. Van Howe.
I didn't.
But Carla, thank you for reminding us, because that was a really, really good thing, and it was a good way that this community pulled together and got care for people.
That was in the basement, wasn't it?
It was amazing.
Yeah.
It was in the occupation medicine.
Yeah, okay, that's my thought.
Yeah, in the medical center.
Go ahead.
I have two questions. Off of David's question about some of the measles outbreak and whatnot. You said that you're concerned about lack of support from CDC. If CDC was working how it should be working, what sort of support would you expect to get?
So what they can provide is some of the epidemiological surveillance of it. So they can bring their people in to help call possible contacts. So in past measles outbreaks, there's an average of 60 contacts per case. That's the average, sometimes it's higher. The cost of surveillance and work time loss from work for people that are in contact and the parents and everything, it's between $25,000 and $50,000 per case of measles is the cost that's involved. So they help with some of the, making sure that you have vaccines available for post-exposure prophylaxis, and they help with the, like I said, the surveillance. It's a lot of time on the phone. You're calling 60 contacts for every case. And they don't always answer the phone, we found, which is annoying.
And then my second question is, have you run into any problems of lack of medications or supplies because of the tariffs and whatnot?
Not yet. So that would probably affect, as far as the health department goes, there's only a couple of medications that we distribute, and most of those are related to the sexually transmitted infections. So, but the rest of the medications people get through pharmacies and other sources, so we're not really directly involved in that. Yeah.
If we wanted to try to put pressure on any part of the state or federal government, do you think that would be useful? And where would be the best leverage?
I don't have a good answer for that. As an employee of the health department, I'm not allowed to lobby, but we are able to, we do have some organizations. For example, there was a lobby organization for the in-school clinics, and they did a good job of making sure that that remained a categorical funding, which kept them in play. There is the MALF, which is the Michigan Association of Local Public Health Departments. They deal with a lot of they track a lot of the legislative things that come up in the state of Michigan. NACCHO is the national organization for the health departments, and so they kind of track things, and they develop policies for people to follow. So they're fairly active in that. As far as individual politicians, I think they respond more on an issue by issue basis rather than a generalized thing. I think if the reduction in the number of people on Medicaid it's going to impact all of us because it's going to impact other people's healthcare premiums and things like that. So that would be an issue that in general that could be addressed. No. Yeah, public health is where politics and health care meet. And right now, it seems like the politics is winning, unfortunately. Yes?
So with the cuts to Medicaid and Medicare and insurance, what will happen to some of the nursing homes and their residents?
Boy, that's outside my area of expertise, but a lot of people that are in long-term care facilities are on Medicaid. I mean, that's a huge part of their expenditures. I don't know. I have no idea. I don't know enough about it. Yeah.
Have the regulations in public schools changed, or are they changing in terms of vaccinations and requirements for
As far as I know, they haven't. Okay. So the parents are allowed to get a waiver, so their kids can still attend school without being fully vaccinated. And in Michigan, they can do it for medical reasons, religious, or philosophical. And one of my counties has the highest waiver rate in the state, close to 20%. It would be near there, yeah. Yeah.
Don't they have to at least meet with a health educator?
No, they need to meet with someone with the health department and have them, get a certain amount of information, probably what we would probably call an informed refusal. It's as opposed to informed consent, and they have to sign on that. And part of the signature, they're saying that if there's measles in the school, I agree that my child will need to stay home for 21 days until after the last case is identified. Yeah, no, the quarantines on that is substantial. That's why it costs so much for each case, because let's say you're exposed, okay, and you haven't been vaccinated, and you're an adult, you can't go to work for at least 21 days. Oh, I know. But we looked at it in that community, in that it would be a high enough number that there's several businesses that would have to shut down because they wouldn't have enough employees. And the disadvantage of having a big pool of all ages, they can all get it at once. Back before the vaccine, it would just come through and get everybody under 5. It would just sweep through and get everybody, because everybody over 5 had it the last time it swept through, because it's so contagious. Yes?
You mentioned earlier that the CDC would help in a measles outbreak with vaccinations of measles.
Yeah, so what happens is they have stockpiles of the vaccine that not everybody does. So they can bring those in.
So would it make sense for someone who had been exposed to measles, who hadn't been vaccinated, to then become vaccinated?
Yes, if you're within 72 hours of being exposed to someone who's contagious with measles, if you get the vaccination, that's protective. So that's part of the reason why we are pushing to have quick turnover on the tests. The state lab extension in Hancock, which is part of Western UP Health Department, we're going to be doing, hopefully we're soon going to be able to do the measles testing locally. So we don't have to, wait 3 days for it to be shipped somewhere else to get the results back.
You can also have a titer done to see if your measles is still active.
Right.
Your vaccine from when you were a kid.
Right.
And that's helpful.
Say that again, sorry.
So,
you have a titer, sorry, Dr. Mann.
yeah, so one of the things we ran into, we had a couple cases of measles here in Marquette County, and we learned a few things. One is that most people above a certain age don't remember, they're sure they were vaccinated, and there's no way they're going to find their vaccine record because mom threw it out with your old baseball cards. And so those people, we used to say, well, we can't tell if you're vaccinated. So there's 2 options. If you're exposed, we can give you another shot and you're fine, or we can do a titer to see if you've been vaccinated before. So there's a blood test for that. But, it might be worthwhile having that so you don't have to know.
Like
So,
I have a bunch of professors at Northern that I take care of. They come from different states, different countries. They don't have their vaccination records because they don't talk to each other.
So it's kind of helpful because they're working with students, so, and they interact with our community too, so.
Mhm.
And that's another instance where it's helpful.
So when I was on TV6 News, and I'm on there so often, I should be on their health. One of the things that I messages I said over and over, I don't know if they broadcast it or not, I don't have cable, so I don't know, is that try to find out if you have a vaccine record, find it, and if you don't know, get the titer, so that way you don't have to worry about it. So, yes.
How could you see the quarantine being enforced?
Yeah, that's another question. We had some problems during COVID in some of our counties where to enforce the quarantine, we would need the cooperation of the county sheriff. And sheriffs are, what are they? They're responsible to no one. And so you need to have someone be willing to enforce it. I think the interesting thing will be the schools will be in a position to enforce it. It'll be interesting to see if they do. The other side of it is that would the schools shut down because there's so many kids, and then you would have pushback from the kids who are parents of the kids who are vaccinated, saying, "I'm paying for my kid to be educated, and you're shut down because of these guys who didn't vaccinate their kids." It'd be a mess. Yes.
So if you have had measles,
Right.
you're immune, correct?
Yep. Yep. Yeah, you are. It's lifetime immunity. That's one of the advantages. And the vaccine does 93% with one shot and 97% with 2 shots. So the vaccine. Yeah, go ahead.
I'm sorry, this is turning very measles, but.
That's fine.
Do the schools not already have a policy in place on what to do if there is a measles case?
Yeah, there are policies that they have.
Okay.
I don't know which file cabinet it's in or how long it's been there. So we work with the schools to try to keep them up to date on their reporting requirements and those type of things, yeah. So we work closely with the schools. We work closely with them during the COVID outbreak as well. Yeah.
With the CDC taking so much offline.
Taking so much what?
Taking so much off the internet
Mm-hmm.
as reference, not only for physicians, but for people, just citizens. Do you have an online source that you find useful for vaccine information, epidemiology?
We relied on them pretty heavily. I know the state of Michigan does a lot of that for Michigan level information. So
The
right.
Department of Health.
Yeah, and they have a new what's the word? A dashboard that's available for a number of measures that they take, and it's broken down by legislative district. The reason they did that is they were hoping the legislators would actually look up the data, whether they have or not, I don't know. But it's not at the county, it's not, if you look at some of our legislative districts, they're kind of interesting. If you want to know the UP data, just look at, it's broken down by McBroom's district, which is basically the whole UP. But they've been putting up information that's more easily available. So, and there are other agencies that collect and report some of this data. So
It's just sort of scattered now.
it's kind of scattered now. Yeah. I don't know. Who knows what's going to happen with the CDC? Anybody have good news? Good joke? I mean, the Tigers and the Cubs both, lost in 5 games. That's impressive enough. Go ahead.
I want to thank you for making this presentation and making these things clearer, even if it wasn't good news. I appreciate you, Dad.
But my point was that it's not clear. So,
It's clear that
But you
it's
have
not.
reassured us that there is no clarity.
You're right. Yeah. All right, thank you.
We'll officially adjourn the meeting, but we have time before we have to get out of the building, so feel free to talk to each other.